Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a hematologist speaking with a patient named Mr. Maxwell. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Maxwell. It's nice to meet you. I understand you're here because your GP is concerned you might be dealing with anemia. Can you tell me a bit more about the symptoms you've been experiencing?
Sure. Well, I've been feeling exhausted lately. It's like no matter how much I sleep, I'm just always tired. My wife keeps telling me to check it out because I'm a bit pale too. And just last week, I felt a little lightheaded when I stood up, but it passed after a few seconds.
I see. So, fatigue, some paleness, and occasional lightheadedness.
Exactly. I figured maybe it was stress from work. I'm a carpenter, so it's physical work, but I don't think I should be this tired. Also, I noticed I get short of breath easily, even with simple tasks. Climbing the stairs can leave me feeling out of breath, which isn't normal for me. I'm usually pretty fit.
Thank you for sharing all of that. Those can indeed be symptoms of anemia, but we'll need to run a few tests to determine the exact cause and type if that's the case. Have you had any recent blood work done?
Yes, my GP had me do a blood test about a week ago. She mentioned that my hemoglobin was low, and my iron levels were also below the normal range, which is why she suggested I come see you.
Low hemoglobin and iron levels can certainly point towards anemia, particularly iron deficiency anemia, which is quite common. There are several other types of anemia, but this is often linked to iron levels, which we'll discuss in detail.
That makes sense. My wife thought maybe it was related to my diet. I'm not a big meat eater, and I heard that can make a difference, right?
Yes, absolutely. Iron-rich foods like red meat, beans, lentils, and dark leafy Maxwells are key sources. If you're not consuming enough iron, it can gradually lead to a deficiency, especially if your body is using more iron than usual. For instance, if you've recently increased your activity level or had any bleeding, even minor cuts or nosebleeds, your iron needs could be higher.
That's interesting. I don't eat much red meat, and I haven't really thought about it. No bleeding, though. I'm usually careful at work, but I have started biking to work, which is new for me.
That's a good insight. It could contribute, especially if your body is adjusting to the new physical demands. There's also a possibility that your body may have difficulty absorbing iron efficiently. Conditions like celiac disease, for example, can affect absorption, as can certain medications.
I see. I haven't been diagnosed with anything like celiac, but I do have acid reflux, so I take medication for that. Would that impact my iron?
Yes, some medications for acid reflux, such as proton pump inhibitors, can decrease stomach acid, which is needed to absorb iron properly. We can explore if that might be a factor in your case.
Okay, that makes sense. So what's the next step?
First, we'll want to confirm your iron levels with a more detailed blood test, which includes a complete iron profile. This will tell us how much iron is stored in your body, not just what's circulating in your blood. I'll also check for vitamin B12 and folate levels, as these nutrients are also important for red blood cell production. Deficiencies in these can cause anemia as well.
And after that, if it's just low iron, what are my options?
Great question. If it's primarily iron deficiency, we can look at dietary changes to help increase your intake of iron-rich foods. If you're open to it, a multivitamin with iron might help, but we could also consider iron supplements. There are also treatments we could explore if absorption is an issue.
I think I'd be okay with that. I'd like to avoid feeling this tired all the time.
Of course. We'll work together to find what's manageable and effective for you. It may take a little time, as increasing iron levels usually happens gradually. Typically, with the right approach, most people start noticing an improvement in energy within a few weeks.
That sounds good. I'd just like to have a bit more energy back. The lightheadedness has also been worrying me.
Understandably so. Anemia can reduce the oxygen-carrying capacity of your blood, which can contribute to lightheadedness or dizziness. Rest assured, we'll monitor your symptoms closely and ensure the treatment helps with that too.
Thanks. It's reassuring to hear. And I suppose I should look into adjusting my diet?
Yes, that would be a helpful step. You might focus on incorporating more iron-rich foods into your meals and pairing them with foods high in vitamin C, like citrus fruits and tomatoes, as it helps with iron absorption. Avoid having tea or coffee directly with meals, as they can interfere with iron absorption.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mr. Davis. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Mr. Davis, please come in. How are you today?
Hi, doctor. I'm all right, but I've been noticing something worrying lately, and I thought I should get it checked out.
I'm glad you came in. What's been bothering you?
It's my legs. For the past few months, I've had this pain in my calves when I walk, especially if I'm walking uphill or for long distances. It starts off as a cramp, then gets worse, almost like my legs are burning. I have to stop walking for a bit, and after a few minutes, it goes away. But it's happening more often now, even with shorter walks, and I'm worried it might be something serious.
That's certainly something we should look into. The symptoms you're describing, pain in your legs when walking that improves with rest, could be a sign of peripheral artery disease, or PAD. It's a condition where the arteries that supply blood to your legs and feet become narrowed or blocked, usually due to a buildup of fatty deposits. When the muscles in your legs don't get enough blood flow, they can cramp up, especially when you're active.
Peripheral artery disease. That sounds a bit frightening. What causes it?
PAD is primarily caused by atherosclerosis, which is the buildup of plaque in the arteries. This plaque is made up of fat, cholesterol, and other substances, and over time it hardens and narrows the arteries. Risk factors include smoking, high blood pressure, high cholesterol, diabetes, and being overweight. It's similar to how heart disease develops, but PAD affects the arteries in your legs, not the heart.
Well, I do have high blood pressure, and I've been a smoker for years. I suppose those aren't helping, are they?
Unfortunately, no. Smoking is a significant risk factor for PAD because it damages the blood vessels and accelerates the buildup of plaque. High blood pressure and cholesterol levels can also contribute to the narrowing of your arteries. But the good news is that PAD is manageable, and by addressing the risk factors, we can prevent it from getting worse.
So, what do I need to do? Is there a treatment for it?
Yes, there are several steps we can take. The first and most important thing is to address the lifestyle factors that are contributing to the condition. Quitting smoking is at the top of that list. I know it's not easy, but stopping smoking can significantly improve blood flow and prevent further damage to your arteries. We'll also want to manage your blood pressure and cholesterol levels more aggressively. I can prescribe medication if necessary, and we'll discuss ways to adjust your diet to help lower your cholesterol.
I've tried quitting smoking before, but I've never managed to stick with it. Do you think it'll make a big difference?
It absolutely will. Smoking directly impacts the health of your blood vessels, so quitting can slow the progression of PAD and lower your risk of more serious complications like heart attacks or strokes. There are many resources we can provide to help you quit, including nicotine replacement therapies, medications, and counseling support. You don't have to do it alone.
I guess it's time to really give it a shot. What about the pain in my legs? Will that go away if I quit smoking?
Quitting smoking and managing your other risk factors will definitely help reduce the severity of your symptoms, but it's also important to stay active. I know that sounds counterintuitive given the pain, but regular exercise like walking is actually one of the best treatments for PAD. Walking helps improve circulation by encouraging the growth of new blood vessels around the blocked arteries. We call it supervised exercise therapy, and it involves gradually increasing the amount of time you can walk without pain.
Exercise therapy. But walking is what triggers the pain in the first place.
That's true, and it's completely understandable that you'd want to avoid it. But what we do is create a plan where you walk until you feel the pain, then rest until it subsides, and then start walking again. Over time, you'll find that you can walk longer before the pain starts. It's important to push through the discomfort within safe limits, because it strengthens your muscles and improves blood flow to the legs. We'll guide you through the process and monitor your progress.
All right, I'm willing to try that. What if it doesn't work? Are there other options?
If lifestyle changes and exercise don't improve your symptoms enough, we can consider medications or more advanced treatments. Some medications can help improve blood flow and reduce the pain during walking. In more severe cases, there are procedures that can open up the blocked arteries, like angioplasty. This involves inserting a small balloon into the artery and inflating it to push the plaque aside. In some cases, a stent is also placed to keep the artery open. Another option is bypass surgery, where we create a new pathway around the blocked artery using a healthy blood vessel from another part of your body.
That sounds like a lot, but I'd rather try to avoid surgery if I can.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing about a patient. Now read the question.
Here, this is Laura Smith. She was brought in with a fractured wrist. She's in a lot of pain, and she's quite anxious about it. Last time she was here for a minor fracture, we managed it with just a splint, but this is more severe. I think a cast is needed this time. However, she's really struggling with the pain, and it might be difficult to apply the cast without addressing that first.
I see. Do you think we should start with some pain relief, maybe something stronger than ibuprofen this time?
Yes, I think a stronger painkiller would help her settle down, and then we can proceed with the cast.
Now look at question 26. You hear a scientist explaining CRISPR. Now read the question.
Targeted changes to the DNA of living organisms. It works by utilizing a protein called Cas9, which acts like molecular scissors, cutting the DNA at a specific location. Once the DNA is cut, the cell's natural repair mechanisms can be used to add, remove, or modify the genetic material. This method has vast potential applications in various fields, including agriculture, where it could be used to create disease-resistant crops, and medicine, where it holds promise for treating genetic disorders such as cystic fibrosis or sickle cell anemia. However, there are still concerns regarding ethical issues and the potential for unintended consequences, especially when it comes to editing human embryos. More research and regulation are necessary before its full potential can be realized.
Now look at question 27. You hear a GP analyzing a patient. Now read the question. So, Mr. Thompson, it seems that your finger is still emitting that strong odor.
Oh yes, it still smells horrible. I've been cleaning it regularly, but the smell of rotting fish just won't go away.
I remember in your first visit you mentioned that the odor was foul, somewhat like decaying fish, and that there was redness and swelling. Are you experiencing any additional symptoms, like pain or fever?
Actually, yes. The finger's been throbbing with pain, and I've had a slight fever for the past couple of days.
Given these symptoms, I'm thinking it might be something more severe than an infection from a simple cut. Tell me, have you had any recent injuries, or handled something unusual? Perhaps in a wet or damp environment.
Well, I did accidentally scrape my finger on some old metal equipment while working near a water tank last week.
That could explain it. Based on your symptoms, I suspect you might have contracted a bacterial infection called Pseudomonas. This type of infection thrives in moist environments. Now look at question 28. You hear an orthopedic specialist talking to a patient about a knee brace. Now read the question.
Now that you've been wearing the brace for a few minutes, how does it feel?
It's not too bad. I was expecting it to feel tighter or uncomfortable, maybe even a bit stiff around my knee, but it's actually quite flexible. Though I do notice a little pressure around the sides.
That's normal. It just needs a bit of adjustment. Now, after a little while, I'll have you try taking it off and putting it on yourself.
I didn't have any issues taking it off earlier, but I'm still a bit worried about getting it on properly. I'm afraid I might not fasten it tight enough.
It's unlikely you'll have any problems with that.
But it does feel slightly off when I walk. It feels like it's not aligned right, and I'm not sure if it's giving my knee enough support.
Is it slipping, or does it feel unstable?
No, just not as supportive as I expected, especially when I put weight on it.
Let's make a few more adjustments and see if it improves.
Now look at question 29. You hear a conversation between a patient and a doctor. Now read the question.
Yes, I was diagnosed with high blood pressure around 6 months ago. I've been trying to manage it by changing my lifestyle, but it hasn't been as effective as I'd hoped. That's why I'm here today.
I see. Your last reading showed a blood pressure of 150 over 95 millimeters of mercury. A normal reading should be less than 120 over 80 millimeters of mercury. What have you done so far to manage it?
Well, I started walking 3 times a week for about 30 minutes, but I haven't been able to cut back on my salt intake, which I know is important for controlling my blood pressure.
I'm going to recommend that you...
Now look at question 30. You hear a conversation between a GP and a hospital administrator about managing patients with chronic diseases. Now read the question.
times is becoming more and more difficult, isn't it?
Yes, Dr. Harris. The demand for chronic disease care has grown significantly, but we simply don't have the necessary resources.
Exactly. We're struggling because we don't have enough specialists or the right facilities to provide comprehensive care.
And without dedicated facilities or staff, we can't properly manage these patients, which leads to more hospital admissions.
Yes, many of these patients need ongoing care that we just can't provide in our current setup.
It's affecting not just the patients, but also the quality of service we can deliver across the board.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear Dr. Sophie Graham giving a detailed presentation on chronic care management. You now have 90 seconds to read questions.
My name's Dr. Sophie Graham, and I specialise in chronic care management. Today I'm talking about a critical issue in healthcare, ensuring access to quality, coordinated care. Patients with chronic conditions often require services from various providers in different settings, such as hospitals, primary care clinics, and even home-based care. Coordinating this care efficiently is not only beneficial to the patient, but is essential to improving outcomes and reducing healthcare costs. When care isn't well coordinated, patients may end up with duplicative tests, conflicting treatments, or unnecessary hospitalizations, leading to poor health outcomes. One of the biggest barriers to achieving high-quality coordinated care is the fragmentation of healthcare systems. In many cases, different providers work in silos, meaning they don't communicate effectively with one another about the patient's care. This often results in care gaps or unnecessary treatments. Patients with multiple chronic conditions are especially vulnerable to this issue. For example, someone with diabetes, heart disease, and arthritis might see an endocrinologist, a cardiologist, and a rheumatologist. If these specialists don't coordinate their care, the patient might be prescribed conflicting medications, leading to dangerous interactions. The goal, then, is to move towards integrated care models that encourage collaboration among healthcare providers. These models might include multidisciplinary teams that communicate regularly about the patient's condition and treatment plans. We've seen some success with models that employ case managers, professionals who act as the point of contact for patients and ensure that all providers are on the same page. Case managers can help arrange appointments, manage medications, and keep track of patients' progress. This kind of coordinated approach can significantly reduce hospital admissions and improve patient outcomes. Research has shown that one of the most effective ways to provide coordinated care is through the use of electronic health records, EHRs. EHRs allow all of a patient's healthcare providers to access the same up-to-date information, reducing the likelihood of errors. Despite this, the uptake of EHR systems has been slow in some areas, and even when they are used, the systems may not be compatible with one another. This is a major issue, as patients frequently move between different care settings, such as from hospital to home care, or from a specialist to primary care. Ensuring that each provider has access to the same information is key to a smooth transition. Another important factor in coordinated care is patient education. It's crucial that patients understand their own healthcare needs and how to manage their conditions. This becomes especially important when patients move between different settings, like from a hospital to home care. If they don't understand their medication regimen or follow-up care instructions, they're at risk of ending up back in the hospital. Patient education can be improved through the use of health coaches or nurse educators who work directly with patients to help them understand their care plans and make informed decisions. Family caregivers also play a crucial role in coordinated care. For many chronic care patients, family members are the primary source of support, especially when it comes to managing medications and ensuring follow-up appointments are kept. However, caregivers often report feeling overwhelmed, especially if they aren't included in discussions about the patient's care plan. It's vital that healthcare providers involve family caregivers in the decision-making process and provide them with the resources they need to support their loved one effectively. Community-based support programs can also help by offering respite care or providing caregivers with training on how to manage specific conditions. Finally, I want to emphasize the importance of community-based support networks. Chronic care patients often benefit from services like home health aides, physical therapists, and social workers. These professionals can provide care that allows patients to remain in their homes rather than requiring a hospital or nursing home stay. However, the availability of such services varies widely, and in some cases, patients are unable to access the care they need. Expanding access to community-based care and ensuring that these services are fully integrated into the healthcare system are critical to achieving better outcomes for patients with chronic conditions. In summary, the keys to improving coordinated care are integrating healthcare providers through systems like EHRs, providing adequate patient and caregiver education, and ensuring access to community-based support. By addressing these areas, we can improve care outcomes, reduce hospital readmissions, and ensure that patients with chronic conditions can lead healthier, more independent lives.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Nathaniel Parker. Now, read the questions. You now have 90 seconds to read questions.
Good morning, Dr. Nathaniel Parker. It's great to have you here today. I understand you've recently been researching how healthcare professionals can better communicate with patients suffering from cognitive impairments, like dementia or Alzheimer's. Could you share what prompted your interest in this field?
Good morning, and thank you for having me. Yes, my interest in this topic was sparked during a hospital visit when I witnessed firsthand how communication can go wrong with cognitively impaired patients. I was observing the case of a woman in her 70s who had Alzheimer's and was admitted with pneumonia. Despite the medical staff's best efforts, she became quite agitated and confused when they tried to explain her treatment. At one point, she even refused her medication because she couldn't understand the purpose of it. This situation demonstrated to me how crucial it is to adapt our communication methods for patients with cognitive decline.
That sounds like a very difficult situation. How exactly should communication be adapted for these patients?
The key is simplicity. We must break down information into digestible parts and steer clear of complex terms. For instance, instead of saying something like, "This antibiotic will target the bacterial infection in your lungs," a simpler version would be, "This medicine will help you feel better and breathe easier." It's about making sure that the language we use is clear and easy to follow. Additionally, repeating key points is critical since many patients with cognitive impairments struggle with short-term memory. Repetition helps them grasp the information without feeling overwhelmed.
I imagine the hospital environment can make it even more challenging for patients to process information.
Absolutely. Hospitals can be noisy, and patients with cognitive impairments often become easily disoriented or distracted in such environments. That's why it's important to hold one-on-one conversations in quiet, private spaces whenever possible. This allows patients to concentrate on what's being communicated without external disturbances.
You also conducted a survey on communication with patients with cognitive impairments. What did the survey reveal?
Yes, we surveyed patients and their family members across 3 hospital wards, focusing on their experiences of communication during their stay. One of the most positive findings was that patients responded well when visual aids and gestures were used alongside verbal instructions. These nonverbal communication methods seemed to help overcome some of the challenges posed by cognitive decline. However, one area where we received criticism was that staff often seemed rushed during interactions, which made patients and family members feel uncomfortable asking for clarifications.
It sounds like there's a need for both clearer communication and more time spent with patients.
Precisely. The survey highlighted how critical it is to take the time to ensure patients understand their treatment, especially in this vulnerable population. Another finding was that patients preferred interacting with a consistent group of nurses rather than seeing new faces every day. Continuity in care seems to build trust, which in turn improves communication.
Those are very interesting findings, Dr. Parker. Thank you for sharing them with us today.
That is the end of Part C. You now have 2 minutes to check your answers.